Understanding falls. Common causes of falls. 5 common reasons for falls among the elderly: changes in gait and increased weakness. Approximately 20 to 50% of elderly persons are affected by gait disorders. Environmental factors such as climbing stairs, clutter in the room, dizziness, decline in sensory functions, seeing and hearing. Residents who have difficulty hearing and those who cannot see well with or without glasses are at risk of falling, and cognitive impairments. In addition to causes of falls, we got peripheral neuropathy, sensory condition that causes tingling, numbness, and weakness in the legs and feet. Limited physical activity and medical conditions, stroke, heart failure, and Parkinson's. Sudden decrease in blood pressure, cardiac problems, anxiety, dizziness, medication side effects. Environmental factors, objects on the floors, poor lighting, slippery floors, and throw rugs. Common causes of falls: bending over too far or reaching too high may cause a person to lose their balance and fall. Seniors may fall when hurrying to the bathroom to prevent an accident, and in some cases, seniors fail to make it to the bathroom in time. May also include loss of memory, cognitive impairments, poor problem-solving abilities, decreased ability to understand directions. Dementia. Residents with dementia may become disoriented and highly agitated and are more likely to wander and may fall when doing so. The following are common reasons for falls: dementia, hypertension, and bending over. Fall risk assessment. Accurate and thorough fall risk assessments are essential in the planning and development of an effective fall prevention program. Identification of residents at high risk for falls is essential. A fall risk assessment is completed when first admitted. Thereafter, assessments are conducted quarterly or after a significant change in the resident's condition or behavior and after a fall. The interdisciplinary team, the IDT team, usually includes the provider, the MD, nursing, social work, dietitian, and rehab. They must identify all possible risk factors that could increase the likelihood of that resident having a fall. IDT should note any medical conditions such as dementia that may have caused the person to become confused or agitated. IDT should review any fall interventions that were implemented prior to the fall. All falls should be addressed during the QAPI program and discussed as part of that process. Common risk factors: history of prior falls or multiple falls, fear of falling, incontinence, gait disturbances, generalized weakness, current illness. They could have a cold or infection. Medical conditions including neuromuscular and circulatory problems. Cognitive changes, especially in the ability to think clearly and make decisions. Medications may reduce mental awareness, sense of balance, and interfere with gait. Additional common risk factors: recent vision changes, hearing difficulties, which could impact the ability to hear a redirection or warning, behavioral changes, certain medications, environmental dangers such as a messy or dark room, improper footwear such as slippers, shoes that are ill-fitting, or footwear that provides poor support, foot problems such as corns and calluses, and pain. Implementing a successful fall prevention program: orient the person to their current surroundings. People who are unfamiliar with their surroundings are more likely to fall. Keep surroundings clean and organized to promote safety. Clean up spills promptly to avoid wetness. If someone prefers a messy room, document it in their care plan. Cluttered environments increase risk of falling. Do not rush while providing care. Rushing a person while trying to sit up might cause them to become dizzy and they could fall. This condition is called orthostatic hypotension and results from a sudden decrease in blood pressure. Be certain to use any assisted or safety devices such as wheelchairs, grab bars, and walkers. They are indicated in the care plan. Check to make sure they are in good working condition. You should not use side rails or physical restraints to limit a resident's mobility. They have a higher incidence of falls and injuries when they are restrained. Alternate solutions to side rails include positioning and body pillows. Be sure to closely monitor whoever has been identified as a fall risk. If you notice any other unusual behaviors, such as increase in agitation or confusion, immediately report these and any other changes to the nurse provider. Post-fall assessment. Some falls are unavoidable despite best efforts. Possible causes: trip over unseen objects, loose footing, bend over too far, and may have a medical condition. Falls are to be taken seriously and assessed as soon as possible. When a fall occurs, follow these steps to ensure the resident's safety and prevention of future falls. Ensure the resident is safe and notify the nurse provider of the fall. Any new interventions are then added to the care plan. In addition to fall assessments, what is the most likely reason that the resident fell? How can we prevent them from falling again? What was the time, the place, location of the staff, ratio of the staff? Environmental factors also should be evaluated. Behavioral issues can be contributing factors to fall. Did they exhibit just prior to or at the time of the fall? Fall prevention is everyone's concern.